what's in the cans? Just a quick reminder of what's in here. We do want to understand if there's been any trauma that has been experienced by your child. We don't need to ask questions. If we have something that tells us they've had trauma exposures, great, we'll take that. And we'll just verify it somehow, okay? Strengths, what are those strengths that they have, and what are, have they had opportunity to develop strengths, and where are they? What's going on in their life, right? How are they functioning in different areas of their life, school, relationships? Are there any specific cultural needs, language, and culture could be religious background. It doesn't have to be ethnicity, right? It could be, I grew up in a very religious family. And so, when we would travel, we would pray before we had a meal, right? No matter where we were. And sometimes we'd get harassed by people, right? That's a cultural need, right? Behavioral emotional needs, those are your stereotypic mental health needs, right? And as Dr. Israel said yesterday, the CANS is not a diagnostic tool, but it's consistent with descriptions of diagnoses, and so therefore can be helpful. And we also assess risk behaviors, these things that could potentially hurt your child or others around them. And we do take into consideration caregiver resources and needs. And what's interesting about the CANS is we understand the CANS factors in the fact that as parents, we're different parents to different children. If you have multiple children, you're a different parent to each one of those children. It has nothing to do with you wanting to be fair. So I want to take it out of that kind of thinking. It has to do with different kids of yours need different things of you as a parent. And sometimes you're good at those things, and sometimes you need support around those things. So just think about it, just general, that's how it is as parents. Now, if you've got children with special needs, right, and they might not, those needs they have may not match with your super strengths, then you might need some support. So that's how the CANS takes it into account. Again, it's not a judgment on you as a parent. It's just identifying where you could use some support in parenting this particular child. Okay. All right, one more slide on the CANS, and it's about level of care. So the level of care we call it a decision support model. We don't call it an algorithm anymore, and I'll tell you why. It's a decision support model actually describes what it is a whole lot better. Algorithms that term has been ruined by Facebook and Google and Amazon and all the folks that use models to track our behavior and predict what we want to purchase. So we don't use the term algorithm anymore. Decision support model is actually more descriptive. It's more true to what it is. So the level of care is a decision support model. What it does is it takes criteria that we know clinicians use, not just in Idaho, but also in our field. We know that here's how clinicians make decisions about certain things. We just want to make sure those criteria are applied consistently and reliably. So the CANS actually filters in to the level of care decision support model. So the way it's built is, first, it takes into account life functioning needs across every one of your three levels. So level 1 is outpatient, level 2 is child and family teaming, and level 3 is intensive case or care coordination, right, or wraparound. So the basis to become eligible for any of those levels first starts with having some functional needs. Now, the different levels will have different requirement of functional needs. Then what we do is we take the complexity of your child's presentation, behavioral emotional needs, risk behaviors, and in some cases, if caregivers need support, factor into how the levels fall out and how your child can be eligible for the different levels, right? The more complex a young person's needs are, the more intensive this recommendation will be for services. All right, so let's see. There's some notes here I wanted to catch up on and I didn't keep track of it, right? So it's really important, right, to remember that the level of care identifies the intensity of care that best supports your child's needs as depicted on the cans, which hopefully helps you hear that what I'm saying is get involved in how that cans is put together, the ratings on that cans, because it's going to impact level of care and hopefully impact the treatment plan also. Okay, so we want the cans to really represent the story of your child and your family. Now, the other thing I want to say about level of care, right? We have designed them hopefully so that we can best match the level of care to your child's needs. Higher does not necessarily mean better care for your child, right? It's about the match between your child and the child's needs and the level of care, not how high can you get to. We know from research that we've done with our particular levels of care that when children are placed in lower levels of care than they actually need, they don't do as well. I mean, that's kind of obvious, right? If you have certain needs and you're placed in a lower level, then yeah, you probably won't get the most that you need. But what may be surprising to you is when there's a level of care recommendation, but children are placed in a higher level of care. So in other words, if the level of care recommendation for your child was a 2, right, child and family teaming, but they were placed in intensive care coordination wraparound level 3, what we found in our research is the outcomes are not as good either. It's not as bad as putting them in a lower level of care, but it's not as good as putting them in the right level of care. So higher does not mean better, right? We want kids and families to receive the care that they need based on what we understand of their needs.